Hi, this is Paul Sackers, Good News Broadcast, speaking to Dr. Kaneta Lott. Hi, Doctor. How are you?
I'm very well, Paul. How are you?
Okay, good. You're a motivational and national speaker on the subject of what's in our mouth and dentistry and pediatric dentistry, and you've helped shape the smiles of hundreds of children for over 20 years. Thank you for doing that. I'm sure you made a lot of parents and a lot of young people happy. Good
We have
work.
tried our very best.
Well,
Thank you.
you're really you're renowned in this. So, um, we're going to talk today about it's time to go back to school, to start the year off right, and I think they're learning more and more how important the oral care habits are and oral care to the point that it can affect your entire health if you don't do it right. And so,
It
t-
can.
tell us some of the latest important things that parents should do and young people should do.
Well, as a pediatric dentist, I like to start seeing my children as young as 12 months old, and that allows me to talk with parents, both fathers and mothers, and get them in the habit of cleansing their children's teeth, even before a child has a tooth in the mouth. We recommend that you take a wet washcloth or a 2x2 gauze, wrap it on your finger, and just wash the gums after every feeding. That gets the child used to someone in their mouth and manipulating their oral tissues. And then
That's
as the first tooth comes in, we start with a toothbrush. And then when the children get to be kindergarten and first grade, it is now time to add those fluoride rinses. So between the newborn and that age, parents are already brushing their children's teeth, flossing their children's teeth for them at night, and we do recommend nighttime brushing and flossing as being more important than the morning. And then at this age, we want to add an anti-cavity fluoride rinse that will harden the teeth. Matter of fact, Listerine Smart Rinse has been known and is tested by the lab to strengthen kids' teeth 99% better than just brushing alone.
uh-huh.
So we use both, all three.
They have. I know we did a story on this once. So Listerine has like a blue um, uh, for children. I
They
don't know what they
do have
call
a
it.
blue,
And
and that starts at using that at age 6, but that is a pre-brushing rinse. It You use it before you brush. It tints all the plaque and debris on your teeth a blue color. Okay? Then you floss your teeth and then you brush. And you brush until all of the blue is gone.
right,
And once all the blue is gone, you know your teeth are pretty clean. Then you come back after you've rinsed with water. You take the Listerine Smart Rinse that has the fluoride in it, and you rinse a second time on the end, spit that out, and now you have fluoride still on your teeth. What's interesting about fluoride is that I know we want our children to brush very well, and that is why we use the Listerine Cool Agent Cool Blue.
hmm
However, even if they don't brush super well, the Listerine Smart Rinse acts like a magnet and it attracts everything that is left behind after brushing. And when you spit out in the sink, you're going to see those little particles in the sink. And then the second most important thing is that it has the fluoride in it that's going to stay on your teeth all night long and
what
make
is
them
fluoride?
harder than they ever were.
Well, I'm
Pardon?
sorry. What is fluoride?
Fluoride it is actually a chemical on the chemical table,
hmm
but it binds with enamel to cause the enamel to be stronger than it was even if it had never been in contact with fluoride.
And how does a rinse also help with bad breath? How does it do that?
Oh, well, bad breath comes from leftover food, you see,
Really?
especially in children.
Okay.
And when I make it analogous to your kitchen trash can.
Okay.
If you cook today and say you cook fish and you put the scraps in the trash can, you don't take your trash out, then tomorrow morning your kitchen's going to smell not too nicely.
Interesting. Yeah, sure.
And so
No, it's good.
if you do the same thing with your mouth, you eat everything all day today and you don't get rid of those small little particles, tomorrow morning we've got a problem, you know? So we don't want to have those types of problems.
And is this true that most of the that problem or the concern is on your tongue? What about the brushing your tongue? Is that a fallacy?
No, that's a great thing to do. We have lots of papilla that are on our tongue. That's just little, like little protrusions, let's put it that
Right.
way, on our tongue. And food gets in there, okay, and it will cause a problem. So we do brush our tongue, we brush our teeth, we also brush the roof of your mouth.
The
Now, some
roof.
of the roof of your mouth, yes,
Okay.
yes. And that's just to make sure that we're cleansing every section because you don't want the plaque or the food particles to get back on those sections that you've already cleaned.
Dr. Lott, you always have very important information, starting with, and I think this is something I never thought of or heard of, wiping down the gums of a baby before they even have a tooth, so they're actually, you've already gotten them ready to deal with brushing, right? That's a beautiful thing. The brushing of the roof of your mouth, that's a sort of a new one in my book here, and the reality of the tongue in general. So you always have
Exactly.
positive thoughts here. Good news. Thank
Well,
you.
I would like to create one more positive thought, if I may.
Sure.
Listerine has partnered with AmericasToothFairy.org
Okay.
to assist those children who have limited access to oral care,
Okay.
whether it's they need a toothbrush or toothpaste, whether they need a rinse, whether they need a clinical exam and cannot get to the nearest clinic.
Okay.
And so all of us can do the exact same thing if we go into AmericasToothFairy.org. Look at the website. We can contribute either monetarily or in kind and help children who do not have access to care because 51 million school hours are lost each year to oral health related issues.
Aha.
And we want to cut down on that. So it's not just our children we care about all children.
Sure do. Okay, doctor. Thank you very much. I know you have another interview. AmericasToothFairy.com, and we also have the very informative ListerineKids.com. Thanks. It's always a pleasure, and I always learn something from you. I appreciate it. Thanks.
Thank you so much.
Take
Bye
care.
now.
Bye-bye.